you use a toothbrush every day, or you're supposed to at least, right? So how often should you be replacing your toothbrush? Well, we have Dr. Jennifer Crisp. She's the president of the North Carolina Academy of Pediatric Dentistry, and of course, part of the Crisp practice in our area as well. So you're going to be taking a few of these questions here, and a lot of people at home are like, what do you mean, how often do I need to replace my toothbrush? How often?
So a good rule of thumb is about every 3 months. 3 months you should look to replace it, or if you can look at your toothbrush and if the bristles look kind of frayed or kind of soft or just look like it doesn't look brand new, go ahead and switch it out.
That's right. You need a new toothbrush every a couple of months. So I know there's a lot of people out there who are like, gosh, I can't even remember the last time I got a new toothbrush. Okay. So many people use an electric toothbrush.
Yes.
And I see models for like the kids as well. Is an
Yes.
electric-ish kind of toothbrush okay for kids?
Sure. Yeah, an electric toothbrush is great. I love it because a lot of times they'll play songs and they come in different colors and kids love it. I still say same rule applies to an electric toothbrush. You still need to change out the toothbrush heads. And then also the thing about an electric toothbrush, it does spin and vibrate, but you still have to move it around. I tell people you have to get every tooth and every part of the tooth.
Okay, well, let's kind of like dive into the electric toothbrush thing a little bit more because I've
Yes.
seen a lot of people use it in different ways. So some people
Yes.
just kind of hold it and then they move it. And then other people are kind of like doing this thing. So what should they be doing?
Yeah. So either way is fine. You can hold it and just kind of hold it on one area and just let it, kind of get that spot. But again, if you hold it, you still have to move it to each tooth, every surface of the tooth in that area. If you kind of go across like this, that's fine. But again, just make sure you get top, bottom, front, back, all over.
And I know people are at home are thinking to themselves, I've been brushing my teeth for decades and who knew I was doing it wrong?
Yeah. Yeah.
All right. So there's a lot of people who are scared to go to the dentist. Maybe they haven't been to the dentist in a couple of years. How do we get them kind of getting back into the swing of things?
Sure. So I always say use a buddy system, have someone, family member, friend, whoever that you trust, maybe have them go with you to the dentist in case you're a little bit nervous. Sometimes it helps just to have a distraction, somebody there, maybe someone who's not afraid of the dentist so that they don't give you those nerves too. And then also, I encourage most dentists, if not the majority, they allow kind of like a meeting or like a consult first where you can have an opportunity to check out the dental office, talk to the dentist is huge. And, just kind of sometimes that just kind of helps to calm your nerves just to kind of go in there and see it. And it's just an easy visit is what we call it. We do that a lot for our kids where you just kind of come in, walk around, check it out. You don't even have to sit in a chair, if you don't want to, but it's just an opportunity for patients to meet us. And I encourage that with kids and adults, honestly.
It's like a mini field trip and you go to the dentist and you don't have to have anything
Exactly.
done.
Exactly. Yep. You don't have to have anything done. All you're doing is just checking it out. You can meet the dentist. You can talk to the hygienist assistants, and usually that kind of helps to kind of calm some nerves. Usually.
Okay, we've got about 1 minute left. For folks who are wondering whether they're taking care of their teeth the right way, what are some best practices that you would tell them?
So my encouragement is always to find a dental home. And the reason why I call it a dental home is because that's a place where you go for your checkups, and we recommend obviously every 6 months. But the dental home is somewhere you go if you're having a problem, if you have a question, if you don't know, you can give them a call, you can set up an emergency appointment. You can just make sure that you're just maintaining your dental health because it really is something that you should strive to go to the dentist every 6 months. Sometimes your dentist will recommend more routinely. But again, if you have that dental home, someplace where you're established, your dentist can follow you, let you know if you're on the right track and do all
Hmm.
those things.
Something familiar instead of when there
Exactly.
is like an issue. All right. I appreciate your
Exactly.
time and your expertise, and thanks for letting us know about what we need to do with our toothbrush. You might need
Of
to send
course.
that piece of interview to a friend or a family member to let them know what they should be doing. It's going to be in the Two Wants to Know section of our website.